Imagine a single weekly report that has witnessed every major epidemic of the past century. A publication that never stopped, not even during world wars. That publication is the Weekly Epidemiological Record. For 90 years, it has chronologically publishing the advance of diseases, the triumphs of eradication, and the ever-changing challenges of global health. This is not just a record, it is the living history of epidemic intelligence.
Origins of the WER, the League of Nations era.
The journey began in 1921, when the League of Nations established a health section to monitor international disease threats. In 1923, with Rockefeller Foundation support, it expanded operations, even opening a bureau in Singapore. On First Friday in April 1926, the very first Weekly Epidemiological Record was published. The objective was to provide the world with information about infectious disease hazards. It was a concise bulletin focused on 5 notifiable diseases: cholera, plague, smallpox, yellow fever, and typhus. From that day forward, every Friday, the WER was issued without interruption. From first issue to global necessity. During the influenza epidemic of 1926-1927, its frequency doubled to twice a week, evidence of how vital it had already become. By the 1980s, the WER was publishing broader analyses of diseases like meningitis, dengue, and malaria, along with strategies for containment.
War reduced the words, not the will.
The 1940s brought enormous disruption. During the Second World War, reporting centers in Asia fell silent. By 1942, the WER had been reduced to a single pay, yet publication never ceased. In 1945, as restrictions lifted, mortality statistics returned. 1 year later, the League of Nations dissolved, but the WER survived under the newly formed United Nations. By 1946, the World Health Organization assumed responsibility.
A new era of speed, telegraphic bulletins.
In 1949, the WER added a major innovation: daily epidemiological bulletins sent worldwide by telegraph. Information about outbreaks of plague, cholera, yellow fever, smallpox, and typhus now moved at unprecedented speed. Expanding surveillance. In the 1950s, the WER reflected the realities of an interconnected world. Reports focused on vaccination certificates and the sanitary status of airports. In 1951, the international sanitary regulations were updated, and relapsing fever was added to the list of notifiable diseases. In 1957, a single paragraph announced a new outbreak, the so-called Asian flu. Within months, pages of the WER tracked its spread, as the pandemic went on to claim 2 million lives worldwide. By the 1960s, it had become clear that infectious diseases could spread faster than ever. In 1969, the international sanitary regulations were overhauled and renamed the International Health Regulations, creating a new legal framework for disease notification and response. From emerging epidemics to the end of smallpox. In the 1970s, the WER expanded its scope beyond infectious disease. Reports included foodborne toxins, congenital rubella, smoking, and cancer surveillance. In 1976, it carried some of the earliest reports of a deadly new virus in Sudan and Zaire, later named Ebola. But there was also cause for celebration. In October 1979, the WER published a photograph of a Somali man identified as the world's last known case of endemic smallpox. It was the ultimate victory, the eradication of one of humanity's oldest scourges. Publication of emerging viruses and global crises. In 1983, the WER published its first report on acquired immune deficiency syndrome, or AIDS. At that time, the causative virus had not yet been identified, but cases were doubling rapidly, and nearly half were fatal. The late 1980s and early 1990s brought new challenges. Reports documented the arrival of bovine spongiform encephalopathy, commonly known as mad cow disease, and its human counterpart, variant Creutzfeldt-Jakob disease. Once again, the WER was a platform for timely global health intelligence. From weekly pages to real-time portals. At the start of the 21st century, the world faced another shock: In early 2023, the WER reported on a mysterious lung disease in southern China. The illness, later known as Severe Acute Respiratory Syndrome, or SARS, spread rapidly across borders, disrupting economies and international travel. The outbreak revealed weaknesses in global surveillance. In 2005, the international health regulations were revised once more, expanding their scope beyond a fixed list of diseases. From then on, outbreak alerts were managed through web-based systems such as Disease Outbreak News. The WER adapted by focusing on immunization policy, vaccine guidance, and disease elimination programs. The modern era, 2010s. In the 2010s, the WER continued to serve as the weekly record of global public health. It supported the selection of influenza vaccine strains through a worldwide laboratory network and reported on elimination campaigns for diseases like polio. The West African Ebola epidemic of 2013 to 2016 underscored the continuing importance of timely, accurate, and widely available information. Throughout, the WER remained a trusted source of global health intelligence. Conclusion. For 90 years, the Weekly Epidemiological Record has been more than a bulletin. It has been a witness to epidemics, a guardian of public health, and a guide for the global community. From its beginnings in the League of Nations to its role today within the World Health Organization, it stands as a testament to the power of information in protecting lives. The WER is not just a record, it is a legacy of vigilance and resilience. Next week, we will discuss about the common outbreaks reported since 2020.